Hi, I'm Asha. I'm going to be your nurse today. Can you tell me your first and last name and your birth date?
Bryce is November 8/29/04.
Okay, and then we're going to go ahead and ask a few more questions. Can you tell me where you're at?
The hospital.
And can you tell me what we're going to be doing here?
Head-to-toe assessment.
Okay. And can you tell me who the President of the United States is?
Donald Trump.
Okay, good. We're going to go ahead and start with your vital signs. So I'm going to start with your pulse. Okay, good. And can you rate your pain, 0 being no pain at all and 10 being the worst pain?
0.
Okay. And then we're going to go ahead and do your blood pressure. And turn your arm like that. There you go. (110/70). And go ahead and take a step off the bed and step onto our scale over here and we'll get a weight. Okay. Go ahead and sit back down. And go ahead and face me. And we're going to start with her head. So I'm just going to palpate her head and see if there's any lesions on there. I'm also observing her skin on the outside that I can see to see if there's any lesions or anything. And there is none. Any pain on your head?
No.
Okay. And then I'm going to have you clench your teeth, smile, frown, and puff your cheeks out. Good. And I'm going to feel for your temple over here. Good. And go ahead and clench your teeth. And clench your teeth again. Good. Open, close, and open against me. Good. Okay, now I'm going to go ahead and move on to her eyes. So first I'm going to, you would do the Snellen eye chart for this, but we don't have that, so we're just going to move on to the confrontation. So go ahead and cover up the same eye and you tell me when you see my finger.
See it?
Okay, other side.
I see it.
Okay, good. And then I'm going to move on to the light. So I'm going to have her look over my shoulder and I'm going to look for pupil dilation. Good, other side. Good. And then I'm going to have you follow my pen light. So just move your eyes and not your head. Good. 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 And then I'm going to go ahead and have tilt her head up and I'm going to have her look up and I'm going to look at the bottom of her eyelids and go ahead and look down and I'm going to look at the top. Good. And then I'm going to go ahead and shine my light down to make sure there's no abnormal coloring and go ahead and look down. Good. Good. Now I'm going to move on to her ears. So I'm going to push around. You tell me if there's any pain at all.
No.
Okay. Not when I pull either?
No.
Okay, so for this side, I'm going to push this down. Any pain?
No.
No? Okay. And this side, push down. Any pain?
No.
Okay. I'm going to plug this ear, and I'm going to whisper 2 words over here, and you repeat them back to me, okay?
Apple, banana.
Good. And this side?
Orange.
Good. So now I'm going to move on to her nose. So here I'd also use the otoscope, just like I would to look inside the ears. I would also use that for the nose and for the mouth to look at the tonsils. But I'm going to use my pen light. For her ears, I would want to make sure that her eardrum is shiny and translucent on both sides and that there is light reflecting off of it. So I'm going to go ahead and look up her nostrils to make sure there's no abnormalities or anything up there, and there isn't. I'm going to have her plug one side of her nose and blow in and out. And other side, in and out. Good. And then do you have any pain around there?
No.
Okay. I'm going to press against your sinuses, and you just tell me if there's any pain. None?
No.
Okay, top?
No.
None? Okay, I'm going to go ahead and do her mouth and throat. So for this, I'd have a tongue blade to press her tongue down and to look on either side of it. But I don't have one, so we're just going to have her stick her tongue out. So go ahead and stick your tongue out. Say, ah. Good. And move your tongue to the side. Good. Other side. Good. And go ahead and stick it out. Move to side to side. And say big ah. Good. Okay. And for this, I'd also palpate the inside of her mouth with gloves for any lesions. And I'm going to do hand hygiene right after that. And then I'm going to go ahead and start palpating her neck. So I'm going to look for any abnormalities, any lumps, bumps, or any swelling. Any pain around there?
No.
Okay. And then as long as there's no swelling, I'm going to move on to your lymph nodes. You just tell me if there's any pain.
No.
And there's no swelling. No pain?
No.
Okay.
No.
I'm going to go to the front of your chin. Any pain?
No.
In back?
No.
And none right here?
No.
Okay. And right here?
No.
Okay, curl your shoulders forward, and I'm going to feel right clavicle. No pain?
No.
Okay. And then we're going to go ahead and listen to her carotid artery. So I'm going to have her sit back. I'm going to listen with the bell of my stethoscope, and I'm going to have her breathe in and out and hold it. Breathe in. Good. Other side in. Good. Okay, and I'm going to have you, can you lift your head up, down, to the left, and to the right. And then I'm going to go ahead and have her face that way so I can palpate her thyroid gland. Just lean back just a little bit. There you go. Any pain?
No.
Okay, so hers is grading, and it doesn't feel like she has any lumps or anything on it. So I'm going to have her face me, and I'm going to look at her trachea to make sure it's center aligned and make sure there's no, go ahead and look up. Make sure there's no lumps or anything and make sure everything is intact. And then we're going to go ahead and move on to her chest and lungs. Do you have a sports bra on? Okay, can you go ahead and remove your tank top and face that way? And we'll start with the back of your, on your back with your lungs. I'm going to start with palpation. Do you have any pain around here?
No.
Okay. And then I'm going to go ahead and percuss her lungs. No pain?
No.
No pain?
No.
Okay. Other side. No pain?
No.
And then I'm going to go ahead and listen with the bell of my stethoscope. Breathe in. Good. Breathe in. Good. In. Good. In. Good. In. Good. Other side. In. Good. 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 One more. Good. And then I'm going to have her face me. I'm going to do the same thing. I'm going to check that her respirations are even. I'm going to make sure that she's not short of breath. No, nothing too fast. She doesn't have abnormal respiration. So I'm going to go ahead and press on this side. No pain or anything on your front, on your anterior. Okay. Okay. Then I'm going to go ahead and listen to her lung sounds on the front. Good. Good. Other side right here. Good on this side. Good. And then on this side, while she's facing me, I'm going to go ahead and do her upper extremities. So I'm going to have her stick her arms out and push against me. And push against me again. Okay. And while she has her hands out, I'm going to go ahead and check her capillary refill on these. Does look like it's less than 2 seconds. Okay. Then I'm going to do her radial and brachial pulses bilaterally. Good. And then her brachial. Then I'm also going to feel for her epitrocular node on her elbow. Any pain right there? No. Okay, other side. Good. And go ahead and lay down. I'm going to go ahead and look for jugular pulsations in her neck. Go ahead and sit up just a little bit more. Sorry. and then I'll have you lay down. Okay, lean your head back. Oh, not so far. Right there. There you go. Now I'm just going to shine the light right over her neck to see if there's any pulsations. And there isn't. So I'm going to have her lay down. And we'll go ahead and start with her heart. So I'm going to listen with the bell and the diaphragm. I'm going to go ahead and lift this up right here. And then I'm going to go ahead and switch to the bell, and I'm going to listen again for any heart murmurs or breweries. I'm going to lift this up again. Good. Then I'm going to go ahead and switch to my diaphragm again, and I'm going to listen to our apical pulse for a full minute. Okay, good. And then while she's laying down, I'm going to go ahead and start with her abdomen. So I'm going to go ahead and auscultate first before I percuss or palpate. And I'm going to listen with the diaphragm in all 4 quadrants. Good. And then I'm going to switch to the bell, and I'm going to listen for any breweries along her aorta and renal and iliac. And then I'm going to go ahead and percuss. First, I'm going to percuss in all 4 quadrants to make sure there's tympany in all of them. And there is, so I'm going to make sure, I'm going to go ahead and do percuss for her liver. So I'm going to start at the top. Steps right there. I'm going to go back up. Good. And then I'm going to go ahead and percuss for her spleen. Good. And then I'm going to go ahead and start with palpation. So I'm going to do light palpation, then I'm going to do deep. You just let me know if there's any pain. So I'm going to start with light. And for here, I'm just feeling if there's any enlarged organs or anything abnormal. No pain?
No.
Okay, then I'm going to go ahead and move to deep. No pain?
No.
Then I'm going to have her take a deep breath in, and I'm going to see if I can possibly palpate her liver. Go and take a deep breath in. Good, and so hers is not palpable. And then I'm also going to palpate for her spleen. Go ahead and breathe in. Good. Okay, so she had all active vowel sounds, so I'm going to go ahead and chart that on here. And then I'm going to go ahead and start with her lower extremities. So first I'm going to have her bring her knees up and out, just bring them down just a little bit more. And I'm going to feel for her popliteal pulse. Good. Then I'm going to move down to her feet. Good. And then go ahead and turn her feet in. Good. I'm going to feel for her dorsalis fetus. Good. And then I'm going to check her capillary refills on her toes while I'm down here too. Good. Good. I'm going to have her sit up. We're going to go ahead and do sensation with your neurological system. So I'm going to do your face, your arms, your lower legs, and your feet. And you just tell me if it's soft or sharp. Go ahead and close your eyes.
Soft. Sharp. Soft. Sharp. Sharp. Sharp.
I'm going to move down. Go ahead and uncross your feet.
Sharp. Sharp. Soft. Soft.
And then I'm going to go ahead and take her finger. And I'm going to move it up or down. And you close your eyes and you tell me if it's moving up or down.
Down. Up.
Other side.
Up. Down.
And with your toes.
Down. Up. Up. Down.
Okay. And then I'm going to go ahead and put two objects in your hands. Go ahead and open them and close. Keep your eyes closed. And you're going to tell me which each of them is.
This one's an earring and this one's a paper clip.
Good. So go ahead and give me those back. And we're going to go ahead and do, come on, face me. We're going to do finger to nose test. Okay. So you're going to, when I say nose, you're going to touch yours. And when I say finger, you're going to touch my finger. Okay, go ahead. Finger, nose, finger, nose, finger, nose, finger, nose, finger, nose. Okay, go ahead and lay down. And we're going to do the heel to shin. Okay, so go ahead and take your right heel and drag it all the way up to your left leg. Good. Back down again. Good. And other side. Good. Good. And then we're going to go ahead and do her reflexes. So I'm going to have her sit up. And for this, you'd use a reflex hammer, but I have my stethoscope. I don't have a reflex hammer, so this is what we're going to be using. So I'm going to first take your arm like this. Good. Good. And then I'm going to do her, hold her thumb. Good. And then I'm going to lift her arm up and hit the back of her elbow. Good. And then I'm going to do it for both sides. Like that. There you go. Good. Good. And then I'm going to hold her elbow up. Good. Then I'm going to do her knees. So go ahead and lean back just a little bit so your feet are off. I'm going to hit right below the knee. Good. And the other one. Okay, go ahead and lay down. And we're going to do your Achilles. Okay, go ahead and bend your knees. And I'm going to hit right on her. Good. And other side. Good. And then I'm going to have her lift her feet up, and we're going to do plantar. So I'm going to slide my pencil up on the bottom of your foot. Good. And then other side. Sorry. Stop. Sorry. Okay. And then we're going to go ahead and move to muscular skeleton. So I'm going to have her stand up. And go ahead and walk to me. And go heel toe back. Good. And walk on your tiptoes to me. And walk on your heels back. Then we're going to go ahead and do the Romberg sign. So go ahead and stand, close your eyes, feet together. And I'm just checking, and she's going to stand like that for about 15 seconds. Good. And then we're going to do the shallow knee bend. So go ahead and hold on to my arm. Go on one leg and bend. Good. Other side. And both. Good. And go ahead and turn around. And go ahead and touch your toes. I'm going to feel your spine. Make sure there's no abnormalities. She doesn't have scoliosis because her spine is straight. And I'm just feeling her shoulders are even. I'm going to have her stand up. I'm going to hold your pelvic bone and go ahead and lean to the right. And lean to the left. Touch your toes. And lean back. Good. And then I'm going to go ahead and have her sit down and she can put her shirt back on. And then do you have any more questions for me at all?
No.
Okay, thank you.